A very warm welcome to all the viewers of Parvasi TV. We have Ontario's Deputy Premier and Health Minister Sylvia Jones with us today. First of all, a very warm welcome to Parvasi TV, Minister.
Thank you very much. It's wonderful that you asked me to join you.
We saw this exciting announcement that you made today morning about the plan for connected and convenient care. You talked about the three pillars, the third one being hiring more healthcare workers. In Ontario, we've been talking about bringing in more doctors and nurses from other provinces, but are the healthcare workers who are willing to change their provinces and come to Ontario being given any additional incentives or any additional support by the Ontario government? Is there a concrete plan?
So as part of our plan in step 3, as you referenced, we are going to, with legislation, ensure that if you are practicing in another part of Canada, that you will be able to come seamlessly into Ontario. And I don't think it would come to a surprise that we don't actually need the incentives because people want to live and work and raise their family in Ontario. So we believe by making it seamless, so that if you're practicing in another part of Canada and you want to live and work in Ontario, you will be able to do that immediately and not have to go through a second regulatory piece.
Mm-hmm. Also, it would be great if you could help us with some specification about the parallel healthcare program that we are talking about, since it is not clear if we have the private clinics or equipments that are required to carry on a surgery. Also, is there a specific date that these services would be available?
Yeah, great question. So we actually have approximately 800 surgical and diagnostic centers operating in the province of Ontario today. So that might be where you go to get a particular scan, a particular diagnostic. Cataract surgery as a very specific example. A couple of weeks ago, we were able to establish that people were waiting too long to get their cataract surgery done, and we had capacity within a number of these independent facilities. So we announced an expansion of Ottawa, Kitchener-Waterloo, and Windsor. And what it really means is individuals can now get those cataract surgeries done quicker. And you can imagine waiting for surgery impacts your quality of life, impacts your ability to be with your family or working in community. So speeding up these surgeries is really going to make a difference to people waiting.
Mm-hmm. And we've also been talking about bringing in foreign trained doctors. What are the specifications again? What plan are we giving them? Any incentives? And just if you could a little elaborate upon that.
Again, yeah, great question. So what we have discovered is, again, there are lots of people who received their education and in some cases, many cases, practiced medicine in other parts of the world. And when they came to Canada and Ontario, there were very stringent, appropriately stringent oversight, but it caused delays. So what I did in the summer is I directed the College of Physicians and Surgeons of Ontario and the Ontario College of Nurses to say, if individuals have applied, you need to process, review, and ultimately license when appropriate individuals. And it really has worked very well. We've seen the highest number of internationally educated graduates get that license that they need to then go and secure employment. And I'm pretty excited about that because as I said, we've seen a historic number, over 6,000 new nurses have been licensed who were practicing or had their education outside of Canada. Today's announcement with the Your Health, it really shows people what we're doing and hold us to account. Review the document, take a look at all of the things that we are doing to make sure that you have access to healthcare sooner. And ultimately, we will continue to update the public on how our changes are making a difference.